FDA announced that it had officially ended that ban on blood donations from gay and bisexual men.
So we're here to answer questions about that. Dr. Todd Ellerin is the acting chief of medicine at South Shore Health. Great to see you, Dr. T. So this policy has long been criticized by gay rights groups and others as being discriminatory. So why was it in place? Let's start there.
Right. So, Eddie, let's go back many years in the early 1980s. What we saw was that HIV patients were turning positive after transfusions. OK, and at that time, between 1981 and 1985, we couldn't screen the blood supply. There was no HIV testing. So what happened was that there were regulations put in place that men who have sex with men, or MSM, were unable to give blood. And the problem was, after that, around 1985, then an HIV test basically was very sensitive. And then from 1985 all the way to 2008, there were only 178 cases of transfusion-associated HIV. But the rules were still in place that MSM could not donate blood. Important to remember, from 2008 until the present, there has not been a single case of HIV transmission from blood transfusions. Blood is very safe. And I think that's the key thing. But despite that, the FDA really only allowed MSM to donate blood back in 2015. Now, that was a good step, but it wasn't a great step, because one of the rules was that if they had sex in the past year, they still weren't allowed to give blood. And that's not okay. That changed with the pandemic, because this crushed our blood donor supply. So we needed blood desperately.
Right.
And in light of that, in 2020, they changed it and said, okay, we'll allow MSM to still give blood, but now the window is 3 months. So that was better, but still not perfect.
So this change also comes with new rules for screening. So what do people need to know about that?
Well, the current screening, and what the FDA has done, is they've removed men who have sex with men or bisexuals from part of the exclusion criteria. And that's a good thing, because remember, the H in HIV is human. We have to remember that. Men who have sex with men, bisexuals, are not the only people who get HIV. Heterosexuals, injection drug users, transgender people are all at risk. So they've removed that. But what they basically said now is that anyone who has had high-risk sex with multiple partners within the past 3 months, they have to defer donation.
Dr. T, this shift comes at a time when there is a severe blood shortage. So is that something that we should be concerned about?
I'm really glad you mentioned that, Eddie, because I'll tell you something. Blood donation is so critical. Someone uses a blood every 3 seconds in the United States. You can imagine there's millions and millions of units of blood that are needed. So it's literally, you can't put a number on how many lives are saved by donating blood. So I think that what's important is we want to balance keeping our blood supply safe. And we do keep it safe, because the testing of blood for HIV, we have very sensitive tests. And we also want to make sure we're not discriminating as well. I think that's the balance that the FDA is trying to strike. We're moving closer to getting to the right spot. It's more in line with other countries like Canada and the UK. I don't know that we're exactly there yet, though. I think that 3-month window is still deferring if you've had high-risk sex within 3 months. I still think that's too rigorous. The current tests probably allow us to really accurately define who has HIV within probably a period of 1 week. So I think there's still room to go.
Okay, Dr. Todd Ellerin, thank you so much. We appreciate